Hello, and welcome to this GIS report with Health in Perspective. Reporting for the Ministry of Health and Social Development, I am Public Health Communications Specialist NATASHA LETTSOME. The Virgin Islands is on the verge of claiming the elimination of mother-to-child transmission of HIV and congenital syphilis. An evaluation team from the Pan American Health Organization, PAHO, and the World Health Organization, WHO, is in the territory this week to commence a 3-day evaluation to confirm the possibility. On the program today, we will be speaking with key personnel within the evaluation team to learn more about the process and to find out where we are as we as a territory seek validation for the elimination of mother-to-child transmission of HIV and congenital syphilis. On the program today, we will be speaking with Dr. MIRIAM CHIPIMO, Dr. BALLARD, and Ms. Noeline Evans. Welcome to the program.
Thank you.
Now, you said something that was kind of interesting and something that was in our local news recently in terms of people who knowingly carry the disease and willfully infecting others. I'm not sure if you were referring to that in general or you were referring to mother-to-child transmission in terms of the decriminalization of it.
Both, actually.
Both.
Both.
So within the Caribbean at large, is it a penalty? Is it a criminal charge to knowingly transmit the disease around the Caribbean?
I think what I've understood in the Caribbean is because the Caribbean has harmonized a lot of policies and laws by territory or region, sub-region, is that it's usually the criminalization is housed under the Public Health Act, where they say that you should not, if you know you have an infection or a disease, an infectious disease, you shouldn't knowingly infect another. Yeah, so that's under that, but not necessarily specific to HIV as far as I know, within the Caribbean.
Okay.
Yeah.
So you met...
I'm sorry, two other things that come under your portfolio as well is synchronizing the laws where adolescents are legally able to have sex and are also legally able to access the health services that they need in order to practice safe sex. So enable them to access contraceptives, condoms, see a doctor, have a pap smear, have a genital check, that kind of thing without a parent if they so wish because they are legally able to. And the other thing too is I know in some countries for sterilization, if you're HIV positive, you are not able or allowed to have children. You are told that your reproductive rights do not exist in some countries, and that's something that I know you're looking at, and we had to make sure that as a country we abided by those.
Now, based on that information you just shared, Noeline, could you tell us if that is having an impact? Are you seeing more teens? Are you seeing more adolescent children coming by or caring more about their health or getting more of these tests done because of that allowance that was made?
Because our country allows it, our legal age of consent in our criminal code is 16, and based on the age of majority act, we allow young people, once they make 16, to access health services on their own and get the contraceptives, get the family planning that they need. It's for the team to ensure that young people know this and that that is being practiced. We have it on the books, but in reality, is it happening?
But is it happening? So we come to make sure that that's
and that's extremely important because while there appear to be very few cases of congenital disease, whether it's HIV or syphilis, one should remember that there's still sexually transmitted infections circulating in the population, and especially the young people are at risk. And while those infections are circulating, those are indicators, those are herald diseases that people are at risk of HIV, and therefore there could always be the possibility of a case being transmitted from a mother to a child. Likewise with syphilis. So we always urge countries in their guidelines to, every time somebody has an obvious sexually transmitted infection, that they get screened for both HIV and for syphilis, and that should be written in so that and offered to everybody so that they can take advantage of it and keep themselves from disease.
And I want to reiterate what Dr. Ballard is saying. Once you have been diagnosed with an STI, be it chlamydia, gonorrhea, syphilis,
Herpes.
your risk of HIV is higher.
It increases dramatically.
As long as you're sexually active and have ever been diagnosed with an STI, as simple as it may be, your risk of HIV increases. And that has been proven by research, it's been proven by medical experience.
Yeah. So not only if somebody already has an STI and they don't know it, that increases their susceptibility because they have discharges which contain the cells which can be latched onto by HIV. But if they already have an STI and HIV, they will spread HIV more easily because of exactly those same discharges and cells.
The HIV
so it goes it moves backwards and forwards.
You open up spaces that otherwise would be protected.
And your lifestyle, based on what you're doing to contract one STI, you're able to contract any other.
Yeah,
and HIV included.
We always say that these diseases travel together.
Yes, they do. And a lot of people think, oh, I only had syphilis, I only had warts, I'm cool. No, you're not. You're even more at risk. I think it can go up to 75% at risk for contracting another STI, including HIV.
And this is whether or not they have been treated. Some of these diseases you can be treated and it goes,
of course.
like gonorrhea and chlamydia.
But if you're not practicing safer sex, you inquire it again, and you pass it on.
Because remember, you can become reinfected if your partner is not treated or whatever you're doing, multiple sex partners, new sex partner, not really sure. You probably went and get tested for HIV, but you didn't have them tested for the other STIs.
Sure.
And I'll tell you what comes into play here are the gender issues now. Women empowerment, young girls empowerment, gender-based violence, disclosure. How do you as a young girl, if you have an older partner or even just a woman in a relationship, how do you bring up the issue that you have an STI or you want to use condoms in the relationship, which you have not used up to now? So if you can't, then you're much more vulnerable to those. So the gender considerations are very key to making sure that women can access and are empowered to have the right to access services or to disclose without being beaten up, thrown out. Domestic violence, which is a key issue.
And the real concern, certainly for the conventional STIs, is that most STIs are asymptomatic in women. They don't have any symptoms, and it's only when their partners develop symptoms that sometimes there are
or they want to have a baby and then
or they're screened as a result of being pregnant. So it's a women
very
unfortunately are very vulnerable. You're absolutely right.
Yeah, very vulnerable.
And this is a very interesting conversation, especially the point that you brought up for people who know they are exposed. When is a good time? How is that good time? Should you disclose? Yeah. How do you go about doing something like that if you were to have not even like HIV, just maybe herpes, whatever? Do you recommend full disclosure, and how should one go about doing such?
Well, maybe Ron, you're speaking about contact tracing now.
Absolutely.
Yes. Because we have to break the cycle.
Okay.
So I believe contact tracing is happening.
Yes, it is.
Here,
it's a key component of prevention, because
so maybe she can speak to the challenges they face in contact tracing.
If someone comes in and they test positive for HIV, syphilis, herpes, chlamydia, gonorrhea, any STI, it is imperative that the health services contact their sexual partners. Sometimes we give the individual that opportunity to ensure that your partner is treated. So most times doctors would say, okay, you test positive, I'm going to prescribe medications for you and your partner. But remember, after treatment, we have to ensure that you have been treated properly and you're clear of the infection, and so both of you have to get tested. you know, and so it's a challenge sometimes when we get the names and numbers of sexual partners of persons who test positive, and some partners refuse to come in and get tested. Some of them say, I prefer not to test here, I'd rather go away. And we say, sure, go ahead, just let us know. Just let us know. Make sure that you let us know that you have been tested, and if you're positive, that you are in treatment. We need to know that you're okay. You know, and sometimes that can be challenging.
And it's challenging because unless they do, and they come back, we can start the whole cycle again.
All over again.
Because most of these infections don't give you immunity to reinfection.
No.
So that's a real problem.
Sexual and reproductive health is, I'm telling you, a key component of family health. And I'm telling you, it has its challenges. We have seen successes where a lot more persons are testing. They're ensuring that their partners are tested before. But we also learned that a lot of women don't even think to have an HIV test before they think about having a child.
Exactly.
Before getting pregnant. That's one thing that we noticed on this journey.
But I'm still interested in finding out how you broach that subject, possibly with a new partner, trying to get into a new relationship. If you, as a man, woman who is positive for some sort of STD or STI, how do you have that conversation to be totally transparent?
Well, you have to, essentially you have to be pretty direct. You can't beat about the bush, because there's a bottom line. You have to say, listen, I'm sorry, but I'm really concerned that I've been told by a doctor that there's a problem.
Or at the end of the day, we're new in this relationship.
Yeah.
We're thinking about having sex. It's my
Yeah.
body. It's your body as well. And we both have a right to know where we stand with STIs.
Yeah.
Our body, our choice.
Yeah, and also have the condom conversation.
Of course.
Have that condom conversation.
We use
because
condoms
that's safer
until.
sex. That's it. It's a simple solution.
But
it's
condoms
not
can
happening.
burst. So I think we
Yeah.
should know before we even think about putting on the
Exactly.
condoms.
That's right.
Absolutely.
Well,
So-
awesome. That was some awesome communication there regarding everybody's safety surrounding STDs and STIs. We segued a bit, but just to come back to you, Dr. CHIPIMO, in terms of the human rights and what you're looking at. For the general consensus of HIV and the feeling that the public has on that, or people who are infected, how do you go about assessing something like that?
Well, first of all, we're following the same procedure for all the 4 components, actually. We'll meet with the policy level, the people who create the laws in the country, policy, which ministries are key. Like in our case, the gender affairs was critical. And of course, those dealing with the sexual reproductive health issues. And then once you've identified what the context is at the national level, the policies, what protocols are in place, what programs, then you have to meet with the service providers, the frontliners. How do they implement those programs? Are they familiar with them? And what are they doing? What's available to the clients out there? And then having established that, then you'll go to that level of the women themselves. And we met women who are living with HIV, and we also have mothers who are, persons living with HIV, sorry, and then women who are accessing the services, pregnant women, antenatal care, who are not necessarily HIV positive, but who are screened for HIV and so on. So how is that happening? And do they know, do they understand why it's being done, and how is it being done? Are they happy with the services, and how do they perceive them? And then would they disclose if they had a problem at home? Yeah, the very things we're asking. And what are their issues with disclosing? And how do they deal with their partner issues if they're partner issues? And what's in place for them if they feel they have a problem? Maybe with the service being given in the facility, health service, or do they know where to go for redress? And what is in place for them? Otherwise, their rights are not protected, And if there's serious gender concerns, have they been brought to their attention? If they feel there are barriers to meeting the issues with their partner, getting their issues addressed, then that woman is basically not empowered, and she's most vulnerable to, so many things. So many things. And she basically would not seek services, she would not disclose, she would not get treatment. And so you end up with one woman who's got a baby who's HIV positive because of those barriers, not because the services weren't available or the laws are not in place. But those are very real barriers in community. Sometimes you have migrants, migrant communities, they're coming from, I don't want to name any country, but another country within the Caribbean. And they have certain perceptions about how they think things are done, or how they feel they might get infected from somebody who has HIV by sitting next to them or eating in the same plate, or, so you'll have to deal with those issues and different cultures. And I believe you have a significant migrant population. Yeah. So again, they're not physical barriers, but it's all, it's there and it needs to be addressed. So you need to reach out to those women, you need to involve them. And so those are some of the issues we're looking at.
And I like the fact that in this process, they're evaluating our myths or misconceptions, where a lot of our men in the Caribbean and locally believe that if their woman is pregnant and she go and she get tested and her HIV test or her syphilis test is negative, then as a man, I'm good too. And we learned, we had to understand today itself from our antenatal patients that your test result is not your partner's test result. And not because I'm negative mean that he's negative too. A man's test result is not the same as a woman's test result. And so it's important for a man, even if their woman is tested negative, to have a test, and because he may be positive. And it's only a matter of time that her positivity will show up.
And it's possible to have a discordant couple.
Yes,
where one is positive and the other one's negative for some time. Absolutely.
You're looking a little puzzled.
How is that possible?
And the reason for that, believe it or not, is that HIV of the sexually transmitted infections is one of the more difficult ones to catch. So, but if you're in a relationship over a period of time when there are frequent sexual contacts, then of course that transmission is almost inevitable.
Sooner or later it will happen.
The point being, if we have these other cofactors that we were speaking about, the STIs, you increase the risk dramatically.
Not using condoms.
And so you need the barrier methods in order to, if you're having a sexual partner that you don't normally have sex with. So it's a very strange mathematical problem, but it works. It's uniform. HIV, normally vaginal sex is actually a relatively low risk, unless you have other cofactors. But the point is, if you have sex many times, you will obviously increase your risk of transmission all the time.
And I know my status, but my partner believe that my status is his. It's a no.
Not so.
It's a no.
And anyone having unprotected sex is at risk.
Anybody who's changing their pattern of partnerships
is also at risk.
Needs to be tested after they've changed their pattern of partnership.
While they're having their partnership and after they change their partnership.
Absolutely.
And maybe before you start one.
It's true.
I'm telling you, in the Caribbean, while you're having your partnerships, you should have a test, whether it be twice or once a year, and after you change your partners, again, before you begin a new partnership.
Absolutely.
I would strongly recommend couple counseling and testing.
Yeah.
I think that's important. It helps with that conversation, that difficult conversation.
I mean, do we have any counselors here that counsel people on sexual activity?
Yes, and I mean, at the National AIDS program over the last 6 years, I can say for sure, when one person comes in and they have a test, I say, encourage your partner to come and get a test as well, because your test result is not your partner's. And some persons, they come in with their partner, so that they both can have the test together. Because, I can get tested and then I send my partner, and the partner can say whatever they want to say. So it's always good when they can come in together. Get tested together. It's something we've been preaching forever.
Now, when we look at, we recommend that you have sex. I mean, you test every year. But in terms of a new partner, in terms of a new sexual partner, you can do that initial test. But who's to say, like you were talking about earlier? So, I mean, what is the safe way to do it? If I have a test with you, we're new partners, and then 6 months down the road, now we retest when initially it was negative, and now we found out somebody has a problem. How do you try to circumvent that to ensure you are as safe as you can, even while testing?
And that's what I say. You test before you get involved, you test while you're involved, and then you test after you've had that involvement.
And the big problem is concurrence.
Concurrent testing.
It means, in other words, if somebody is having more than one sexual partner over a period of time, you can imagine it's almost, and it's unprotected sex, then it's almost impossible to sort it out. So obviously the big message is, if you're going to have several partners, you have your several partners, protect and have protected sex, but you have them sequentially. The point is, you mustn't have concurrent partnerships, because you will never know which way the infection is
going.
Use a condom.
Every
so
time.
it has to be
consistently.
Condomize is the way
Condomize
forward.
and condomize.
Or testing.
Both.
Condom.
Right. Now, Noylin, talk to us about how the evaluation has been going so far.
So far, we know that we have had some gaps, and they have been highlighted in evaluation. We know that we've made some achievements, and that too have been highlighted in evaluation. You know, our strengths and our weaknesses. And it's not just for the evaluation team to come in and dig up what we've been doing wrong, but what we've been doing right, and highlight that as well, because we've also recognized that from before they came in as the national team, and when they came in, they actually had a chance to see for sure where we're strong, where we're not strong, and where we need to go.
Now, in terms of validation, why would that be important for our territory?
It's a biggie. It's a real biggie for us to say, as a country, we have eliminated mother-to-child transmission of HIV and congenital syphilis. It's a badge of honor for us. Cuba did it, and we want to say, as a British overseas territory, as the British Virgin Islands, we too have eliminated mother-to-child transmission of HIV.
Okay. To bring us closer to that vision for CARICOM, an HIV-free Caribbean. That's where we want to get by 2020.
By 2020.
Yes.
Okay.
And not long to go.
Not long, a couple years off. Now, I want to thank you all for coming on the program today and, having this conversation regarding HIV, regarding the elimination of mother-to-child transmission of HIV and congenital syphilis, and, the candid conversation we had in the middle of the interview regarding people's personal protection and how we should go about securing ourselves. I want to thank you all for coming on the program and sharing. And now I will leave you this opportunity to make any final thoughts. I can start with you, Ms. Cox.
Okay, I'm no longer at the Ministry of Health because I've been seconded to the National Health Insurance, and I want to say that here and now. But it doesn't change the fact, Ms. Jason Hannibal, she's taken over the realm. We still offer testing. Testing is still available at the National AIDS Program at the Family Health Unit. Persons can still come in. Testing is still free, and it's available. And we still want people to get tested. Get tested, wear condoms, and have safe sex.
Mr. Chipimo?
Couldn't say better.
Lots of sex. Right. I just want to say, first of all, it's been a pleasure coming to the British Virgin Islands. Lovely people.
It's our
And
first
it's a
time.
beautiful country. Yes,
Thank
we had a
you.
chance to see a little bit more of it. But my heart is with the women out there. And I really want to make sure they know they have a lot of support in this country. They have a lot of support, but maybe they're not reaching out and looking for it. It's out there. And I think you probably need to create a little bit more awareness. And if they have questions or they're not sure about things, they should try and get that information and get those services. But I think the government has done a tremendous job in trying to put a lot of things in place.
Thank you.
And to empower the women in gender. But issues are still, of course, there.
Yes.
But it takes time.
Yes.
But reach out. Don't sit with the issues in your heart, in your head. Go out there, and the people out there to help you. Thank you.
Okay.
Dr. Ballard?
Well, thank you. I'd like to echo exactly what my colleagues have said. It's a pleasure to be here. It's fascinating to be in a relatively small country and see how they have to tackle these problems. A little word of warning, however, verification of mother-to-child of the elimination of mother-to-child transmission of HIV and of congenital syphilis is not the end.
No, it's not.
It's actually the beginning, because if the systems slip, it can all come back again very quickly.
Yes.
Because remember, those pregnant women are a very small proportion of the total population. And so the country has to be on its guard and make sure that their STI services, their HIV services are always up to snuff.
Yes.
They really must be. Otherwise, they go backwards. But having said that, I think you have everything here to be able to sustain the programs. And I wish you well.
Thank you very much. We want to thank our guests, Dr. Ron Ballard, Dr. MIRIAM CHIPIMO, and Ms. Noeline Levens, for speaking to us today as we look forward to being validated for the elimination of a mother-to-child transmission of HIV and congenital syphilis. The HIV virus that causes AIDS can be transmitted from mother to baby if specific actions are not undertaken to prevent the transmission. These actions include early identification that the mother is HIV positive, early access to medication and treatment, preventative procedures at birth, and early treatment of infant, including exclusive bottle feeding. The BVI continues to have relatively low incidence of HIV, with 7 cases identified last year, 2015, and 3 this year for 2016 so far. The community is encouraged to know their status, get tested, and access treatment early in order to have a better quality of life. The community is also encouraged to employ safe sexual practices, which include having one partner, using condoms consistently and correctly every time, and abstaining from risky situations such as alcohol and drug use that could impair judgment. Testing is conducted at the Family Health Unit and the HIV Foundation offices free of cost. Remember, information is key and knowledge saves lives. Reporting for the Ministry of Health and Social Development, I am Public Health Communications Specialist NATASHA LETTSOME. Thank you for tuning in.